Congratulations. You've worked hard on your journey and lost a significant amount of weight. But now you have this hanging skin, sometimes called an apron, that may cover your thighs, your genitals, maybe your back. You've been thinking about having it removed. Maybe a panniculectomy is right for you. A panty what? A panniculectomy is often done after bariatric surgery or other extreme weight loss to remove excess skin. Coming up, bariatric surgeon Dr. Alexandra Zubowitz joins me to answer all your questions about a panniculectomy versus a tummy tuck. Don't go anywhere. You don't want to miss this interview.
You spoke and we listened. Our chewable multivitamins are now dye-free, meeting your demand for more options. These dye-free chewables join our calcium chews and multivitamin soft chews in the dye-free lineup. Visit ProCareNow.com and use code Susan10 to save money.
I'm bariatric dietitian Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast. Do you feel frustrated with all the confusion, all the misinformation when it comes to nutrition for bariatric surgery? Eat this food. No, don't eat that food. Maybe you should fast or try the keto diet. Heck, why don't you just reset your pouch? It's enough to make you give up and say, forget about it. I don't know what to do. Well, I know what to do. It matters where you get your nutrition information. When it comes to your bariatric surgery, nutrition is specific. So let's cut through the nonsense. Let's get what you need to know now. I created Bariatric Surgery Success, the podcast, to give you accurate nutrition information you can count on. The simple, actionable steps every day, strategies that you can put in your lifestyle that work. I want you to feel well, get out there, do what you want to do. So you're in the right place. Let's get started. Do you receive my weekly newsletter, Breaking Down Nutrition? If not, sign up today on my website, breakingdownnutrition.com. You're going to be the first to know about giveaways, freebies, helpful tips at work, the latest podcast, and upcoming interviews that you don't want to miss, like today's episode with Dr. Alex. Joining me in the studio is Dr. Alexandra Zubowitz, a board-certified general surgeon. She specializes in bariatric surgery and hernia surgery, and don't miss this, has performed over 1,000 bariatric procedures. Dr. Alex also has an interest in medical mission work and has been on medical mission trips in both Ecuador and the Philippines. You can find all of her contact information in the show notes. And today, she's here to answer your questions. Hello, Dr. Alex.
Hey, how are you?
I'm great. I'm so glad that you've taken the time out of a busy surgery schedule to join us. Some of my listeners...
Thank you for having me.
Yeah, I'm just so glad you're here because this is such a great topic. You know, some of my listeners may have heard the word panniculectomy and, hey, they may have already had the surgery, but others are hearing it for the first time right now and asking, what did she say? So let's start by having you explain what a panniculectomy is and why you might need this surgery.
So a panniculectomy is removal of excess skin of the lower abdomen or at the level of the pubic bone. Some people have a lot of excess skin, particularly in that region after significant weight loss. Yeah. And this can lead to rashes, skin breakdown, and even mobility issues.
And so is it typical, Dr. Alex, for the skin to cover the genitals, the back, I mean, all the way around the body?
It certainly can. You know, the more weight you lose, the more excess skin you're going to have. And there's also factors like age, too, that can worsen excess skin. As you get older, you lose elastin in your skin, which makes you more prone to having this excess skin. Unfortunately, the only area that's really covered by insurance is specifically the panniculectomy or that excess skin right at the pubic overlapping the genitals sometimes if it's really severe. And that tends to be the place that causes the most medical problematic issues.
So I know people are going, okay, what's the difference between this panniculectomy and a tummy tuck or abdominoplasty? And while we're at it, because I think this is really important, while you're explaining the difference, Talk about how you choose a surgeon, because not everybody's qualified to do this type of surgery, right?
Correct. So the first thing I'd say is find a board certified surgeon. Then you have to decide, what exactly do you want? So a panniculectomy is something that can be covered by insurance. An abdominoplasty is basically a more extensive panniculectomy, but it's considered cosmetic. So if you want something like
go ahead. So I was just going to say, tummy tuck is considered cosmetic, but panniculectomy, is it considered or no?
A panniculectomy can certainly help cosmetic appearance, but because of the fact it's covered by insurance, it's usually associated with certain medical issues that makes it a medically necessary procedure, which is why we can get it covered by insurance.
Oh, no, that makes sense. And so I think as you talk about it and help people understand the difference between the two. So let's say someone decides, I think I need a panniculectomy, but what's the realistic outcome that I can expect? If it's not the full tummy tuck, what can I expect? And then are there things ways to improve the cosmetic appearance of it afterwards?
Yeah, the cosmetic outcome after a panniculectomy and even an abdominoplasty is very variable depending upon the surgeon. So the first thing I would say is do your research with finding a good surgeon. When you're considering panniculectomy versus an abdominoplasty, the big thing is cost. So if we can get a panniculectomy covered by insurance, you can remove the vast majority of that front skin, which tends to be the area that's the most problematic and bothersome to people. And then another part of either panniculectomy or abdominoplasty is what's called diastasis repair. And what that is we take the rectus muscles, which are those muscles in the midline that give you a six-pack, and bring those back to the midline. This is always done with an abdominoplasty. Some surgeons will do that in conjunction with a panniculectomy. Like for instance, I will always do a diastasis repair when I do a panniculectomy, but that's not always guaranteed to be included. So that's something to ask your surgeon.
A great question. So explain just a little bit more about that so that someone would know, what is it exactly I'm asking the surgeon? I think since they're not as familiar with some of the medical terms as we are, how would you explain that so they can go to their surgeon and say, okay, this is what I'm wanting?
Okay. So if you decide, okay, I'm going to go the insurance route and see if I can get my panniculectomy covered by insurance, I would ask the surgeon, do you do diastasis repair at the same time? Or the other way you could say that in layman's terms is, do you bring my muscles back together at the same time as a panniculectomy surgery?
Yeah, I think that helps a lot for them to know that. So if someone says, okay, I'm going after surgery for this, it may cover it. Do you have to meet certain criteria first in order to be approved for the surgery? In other words, are there things that you're looking for in that potential surgical candidate? And are there certain criteria that insurance is looking for before they say, okay, you got the go on this?
Yes, absolutely. So one, the big thing that insurance wants to see is that you've lost a lot of weight. The vast majority of the time that's after bariatric surgery, but I've even had patients that lost a significant amount of weight on their own, especially now with all the newer medications that are helping with weight loss. So I've even had success with getting these covered with people who haven't had bariatric surgery but have lost a lot of weight. So we show significant weight loss and that the weight has been stable for, I say, at least 3 to 6 months, because you want to make sure that you've maximized your weight loss and that your weight is stable there.
So you're and you're looking for some success then in their lifestyle after the bariatric surgeries, that they've lost their weight, they're keeping that off, they're moving forward, because that makes for a good surgical candidate versus the weight regain quickly.
Exactly.
Yeah.
And it's showing that you're putting in the lifestyle changes and maintaining those lifestyle changes.
Yeah, I so agree with that.
And then they want to see, okay, so you've lost a lot of weight. Is the skin causing issues or not? And that's where we start the
Yeah, what would you be looking for when you say it's the skin causing issues? What might they feel as the patient, and what are you looking for? Like sores, rashes, skin chafing, what kinds of things?
Exactly, all of that. We want to document that they're having skin breakdown or they're having rashes. And then what we do is we put them on nystatin creams and different topical treatments to see if that helps.
Are there other skin removal surgeries that are covered by insurance, or is this the main one?
Fortunately, no. The panniculectomy is really the only surgery now for skin removal that's still covered by insurance. The rest is all considered cosmetic.
Okay, so if someone might be saying, oh, you know what? I don't have insurance. I'm going to have to foot this panniculectomy bill myself. Do you know any idea what the average out-of-pocket cost is for the surgery?
So
that's saying that you're going to have to pay the whole thing.
There's a huge variation to cost because then you're getting now into the cosmetic side. So if you want strictly a panniculectomy, out-of-pocket costs, it would most likely run between $8,000 and $10,000. The problem is most plastic surgeons who don't work with insurance and do only cash pay will only do abdominoplasties, and the cosmetic outcomes will be greater, but the costs range more from $10,000 to $15,000. There's also been because of the high cost, big push to getting these procedures done out of the country, but you really have to be careful. I've seen some disastrous complications from that. Plus, some countries aren't safe to travel to. So you really need to do your research if you're going to go that route.
Yeah, please. I so agree with what Dr. Alex says. Don't miss that, because do you or have you had to come in and, how shall I say this, repair or fix botched surgeries that were done in other countries? And is there even the option to do that sometime? Is the surgery been so botched that it's hard to do?
Yes, from both a bariatric standpoint and just a skin, soft tissue standpoint, I've dealt with complications. The biggest one with soft tissue skin, things like panniculectomies, are wound infections. They get back, and then there's no one to take care of these post-surgical complications. The other potential dangerous thing is flying immediately after a big surgery like that puts you at much higher risk for a blood clot. So it's really not recommended to get on a long plane ride where you're sitting immobilized right after going under anesthesia for several hours.
Yeah. I'm really glad that you brought these points up, because I know that's being done. I think it's being done at the same thing right now with the weight loss medications being compounded in places where the regulations aren't tight. So I know that's not surgery, but similar type of thing going on in terms of looking for the weight loss meds or the obesity drugs. Well, we'll be back in just a moment. We'll get into specifics such as how much weight is taken off with this surgery. Stay with us.
Bariatric Surgery Success is thrilled to partner with New Hope Girls, women empowering women. They offer a discount to our community. Code TRANSFORM to save 15% and celebrate our shared commitment to transformation. Shop their beautiful bags at newhopegirls.com.
We're back. Dr. Alex, this is a question on a lot of minds. How much weight is taken off with a panniculectomy?
So, unfortunately, I think you're going to be disappointed with this answer. The actual number of pounds is usually not very high. It ranges from 2. I think the most I've ever taken off is like around 10 pounds, and that's a tremendous amount. People think they're going to, get an extra 20 to 30 pounds off. The biggest thing is the pant size. People drop like 2 to 3 pant sizes because of how bulky and how debilitating all that excess skin can be.
Okay, so I want to jump in right here with you, because I really like this. See, I don't, if someone's coming in just to see how much more weight they can lose, I'm not a big fan of the scale number after surgery anyway. What I want to see are changes, the non-scale victories like you were talking about a minute ago, the changes in your lifestyle, the things that are making your journey successful for the long term. You're not just hopping on the scale and freaking out every day, but you're making these non-scale victories. You're your clothing size has changed. You can move better. You can get up off the toilet. You can walk now. You can swim and do other things. So I like the same thing that you're saying here is that it isn't about the number. And I don't really want them to focus on how many pounds of skin are you removing. But what you just said is that these clothing sizes are going to change. And there's going to be a noticeable change in how you feel about yourself. And that's going to tie into this question from my Facebook group. Will my stomach be flat after a panniculectomy? And what if I start regaining weight afterwards? How do you address those?
So when you look at before and afters of abdominoplasties, the skin removal is almost always in conjunction with liposuction. And that's how you get the super flat beach bod. When you do a panniculectomy, it's not in conjunction with liposuction. Your stomach is certainly going to look flatter. The cosmetic outcome is certainly going to be better. But sometimes you still have what's called this, it's almost shelf look, because you still have some fat of the upper abdomen, even though you take off that excess skin. Now, you can always go back and do liposuction later. And this is a potentially cost-effective way to get almost the result of a full abdominoplasty, because
interesting.
If you do liposuction in an office-based setting, then you don't pay the anesthesia fees, you don't pay the surgery center fees. So it's a more kind of staged procedure, but you ultimately have pretty similar cosmetic outcomes, as opposed to if you do a full abdominoplasty with the liposuction to get that purely, that washboard flat abdomen. That's going to run you $10,000 to $15,000. Now, not everyone is a candidate for outpatient liposuction. When I do it, I always want to make sure the patient doesn't have really high anxiety. They don't have a really low pain threshold, because although the procedure is not painful, you are wide awake during the procedure.
Yeah. So to go back just a second, I'm really glad we're going to go into pain in just a second, because that was another question that came up. Are you worried about the weight regain afterwards, or you're more focused on live the bariatric lifestyle, get out there and make your changes? Because I know this keeps coming up. What if I start regaining weight? I have this surgery and I regain weight. I know this is such a big issue in so many people's minds.
This is what I always tell my patients. If you start to regain weight, just make an appointment with us. Get in to see the dietitian, get in to see your bariatric surgeon, so we can do a deep dive to see what changes are happening to cause you to start to gain weight. You're not going to just suddenly start gaining weight after bariatric surgery if you're continuing to do the exact same thing. So usually I find that people are starting to snack more, or their portion sizes are getting bigger, or they're tending to move to sweets and not the healthiest options.
Yeah.
So after skin removal surgery, you're basically in the same scenario. If you do the wrong kinds of things, you can gain weight. Now, when it comes to skin removal surgery, if you gain a tremendous amount of weight and then lose it all, you can again have a bunch of skin laxity and end up back in the exact situation. So the biggest thing is, just stop the weight gain before it gets out of control, and follow up with your providers to help you with that.
And I forgot to say this in the beginning when we were just getting started, but Dr. Alex works with one of your favorite bariatric dietitians who's on the podcast with me regular, and that's Isabel Maple. So up in Virginia. So you'll notice that when you see all of her information about how to contact Dr. Alex. But so you'd be going and seeing, like in Dr. Alex's case, working with or seeing Isabel Maples, who you hear so often. So I love that partnership between the dietitian and the surgeon. I just think it is so important. Okay, let's talk about pain, Dr. Alex, since this is a big concern. How bad is the pain after a panniculectomy, and what things can go wrong during this type of surgery that someone might never think about?
So I'll be honest, it's not pain-free. The most painful part is usually bringing those muscles back to the midline, and you kind of feel like you did about 1,000 crunches. Most people are off stronger pain medication within 2 to 3 days and then do fine with Tylenol, Motrin. But again, everyone's very different. Mm-hmm. But I will say the recovery tends to be a little bit more arduous than the recovery after just the initial bariatric surgery, because the incision's a lot bigger. And then that's where the main complication is infection. And when you have a bigger incision, slightly higher risk of complication of infection. Now, overall, that risk is still very, very low. The biggest risk factor for that is smoking, which is the biggest risk factor for basically any complication after surgery. So that's one of the big things we stress is to quit smoking prior to getting the surgery to minimize any sort of risk.
Yeah, makes sense. How long does it take to heal? And while they're going through this healing process, are there any restrictions?
So the healing process, the full healing process takes about 4 to 6 weeks. I usually tell people to take off about 2 weeks from work, and then as long as you don't have a very labor-intensive job, you should be okay to go back to work. Most people have a drain. Some providers don't leave a drain, but most surgeons will leave at least one drain. Those almost always come out after the first week, but that is one thing that's unique to this surgery and the post-op care compared to their original bariatric surgery, which very rarely do you ever have a drain after bariatric surgery.
Now, you talked about smoking, stopping smoking. What if someone has a compromised immune system for whatever reason? Does that make them not a candidate? Do you, as a surgeon, address things from a different standpoint? What happens in that case?
Somebody's immunocompromised, it doesn't necessarily mean they can't get the surgery. We just have to be more mindful. We want to make sure they're medically optimized, make sure they're not having some sort of active flare-up or issue, that they're, as healthy as they can be going into the surgery. It's not that they won't do well. It's just that they have to know that there are higher risks, specifically usually a wound infection when your immune system is not up to par.
Okay. Now, as we wrap up, I know I've asked you in rapid fire a lot of questions that people had put into our Facebook group or had wanted to know from you. What haven't you told us that you feel is so important to know if you're considering a panniculectomy?
I think the biggest thing is to appropriately document and address the issues so you can get insurance coverage. And I think that was the mistake made previously and why insurance companies oftentimes denied this. You want to demonstrate that the skin is hanging to the pubic bone. You want to demonstrate that you're having issues with rashes and skin breakdown. Have your primary care provider prescribe you nystatin creams so you can trial conservative management first and have that documented. And then you want to show that you've lost weight and you've kept it off. You want to make sure that you document, and some people don't even think about the issues the skin is causing, so they don't know to tell their doctor, but does it inhibit working out? Does it inhibit walking? Does it make you less mobile? The vast majority of the time, the answer is yes, but make sure you verbalize that so we can document that, so then we can submit to insurance all the reasons why you'll have medical improvement if we get that skin off.
Thank you so much, Dr. Alex. I love that you are so straightforward and honest and open about, everything from pain to who shouldn't have this to what you're going to pay. Don't do it out of the country. It's so much good information. We appreciate it so much. Thank you.
Of course.
Well, you heard it right
Happy
here,
to be here.
folks. Yeah, you heard it right here from Dr. Alex. She has given you the lowdown on what you need to know if you're considering a panniculectomy. So take your time, do your research, make sure that your doctor is board certified, that they're a surgeon, they have experience. If you're interested in finding more about Dr. Alex, you've got all of her information in the show notes as usual, because remember, everything you do, you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Panniculectomy, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Panniculectomy, LLC.